So I think the terms might be daunting to people, but to me, what diversity and inclusion means is approaching every situation from the place of cultural humility.
So diversity is the idea that they're all different kind of folks in the building, and that we might be of different ages and genders and religion and sexual orientations. We might have disabilities. The fact that we're all here doesn't necessarily mean it's an inclusive environment.
To me, inclusion is more about creating that safe space and welcoming environment where people want to share their authentic self.
I grew up in a family of 7 kids, and we're all different. We all brought different things to the sort of dining room table, so to speak. And my parents made sure that each of us sort of had an opportunity to talk about what was important to us, our day, and it was very varied across the dining room table. For me, the inclusion piece of this is incredibly important because it is, I think, the strength of an organization when we can understand the different walks of life that people have come to a job with. And in public health, I think this helps us understand better the people we're trying to provide services for, what the benefits and limitations might be of the interventions that we're bringing forward.
So in my role, I'm really hoping that this video can be kind of the catalyst for folks to begin those conversations, to talk about their stories, and to be able to talk about their stories in the context of having safe spaces to do that.
One of my jobs, or the functions of my jobs, is to engage the various communities. And I thought it was really important that our agency look diverse, that our agency be inclusive, because then in going out to those communities, I can say, you're valued inside these doors and outside.
So I think having a diverse workforce allows us to make those connections, to make sure that those connections are culturally appropriate, so that we have some understanding about the best way to engage, that we are the state's public health entity for everybody, and not just a certain sector of the population. And the only way we can achieve that is by having a diverse workforce.